Good morning, everyone, and welcome back to the Coffee Talk with Dr. Melissa Ramsey, the weight loss habitologist. Today, I want to talk about a medication that doesn't get nearly enough attention as the GLP-1 medications, but can be a fantastic tool for the right person. That medication is called Contrave. Now, before we get started, remember that every patient is different. What works for one person may not be the best choice for another. My goal today is simply to educate you on what Contrave is, how it works, and why I frequently use it as part of my comprehensive weight loss plan. So grab your coffee and get comfortable, and let's chat. What is Contrave? Contrave is an FDA-approved weight loss medication that combines two medications into one pill, bupropion and naltrexone. You may have heard of bupropion because it is also used to help people quit smoking and depression. And naltrexone has traditionally been used to help people with substance abuse. But when the two medications are combined together, they work on areas of the brain that involve hunger, food cravings, emotional eating, and reward-seeking behaviors. Many people tell me, Dr. Ramsey, I know what I should eat, I just can't stop thinking about food. Or I do well all day and then lose control at night. Or I'm not hungry, but I keep snacking. Those are the typical situations where Contrave may be worth discussing. How does Contrave work? One of the ways I explain Contrave is that it helps turn down the volume on food noise. Food noise is that constant mental chatter about food. What am I eating next? What can I snack on? I deserve a treat. I can start over tomorrow. For many people, weight loss isn't just about hunger. It's also about habits, cravings, emotions, stress, boredom. Contrave can help reduce that constant pull toward food so that healthy habits can become easier to practice. Notice I said easier, not automatic. And so who might benefit from Contrave? I often consider Contrave for patients who struggle with emotional eating, stress eating, cravings, midnight or late night snacking, weight regain, food obsession, and difficulty staying consistent. I also like for people who don't qualify for GLP-1s or cannot tolerate the medication. Or can't get insurance to cover it, and just want another option. Some people don't want to take injections. There are multiple tools at my job that is helpful for people to help reach their weight loss goals other than the GLP-1s. Can Contrave be combined with the GLP-1? Absolutely. I get this question all the time. And the thing is, when you're trained in obesity management, you most certainly can combine medications to help you get the best results. Dual therapy means using two medications that work in different ways. A GLP-1 medication such as semaglutide or tirzepatide primarily helps with fullness, appetite control, blood glucose regulation, and Contrave helps more with emotional eating, reward pathways. Think of it this way: the GLP-1 helps with the physical hunger. Contrave can help with the mental hunger. When used appropriately and safely, the combination can be very effective. This is especially true for patients who tell me, I'm not hungry, but I still want to eat. Or I've lost the weight, but the cravings are still there. My appetite is controlled, but I keep snacking out of habit. Those are the situations where dual therapy might be considered. How I use Contrave in my practice. At Get Your Body Back Wellness Center, I always remind my patients that medications is just a tool. The medication is not doing the weight loss. Your habits are doing the weight loss. The medication simply supports those habits. When I prescribe Contrave, my patients are also working on sleep, stress management, habit formation, because my goal isn't just helping someone lose weight. My goal is to help them keep it off. And if you've been struggling with cravings, emotional eating, stress eating, or constant food thoughts, Contrave might be a conversation worth having with your healthcare provider, or come on down to the center. And it just helps to understand how your biology can also play a strong role in your weight loss, and while working on your goals and helping you become consistent. And thank you so much for joining me with the Coffee Talk. And please don't forget to subscribe. And if you are liking this content, please let me know. I'm Dr. Melissa Ramsey, the weight loss habitologist, and I'll see you next time for another Coffee Talk.